the moment. We all know we are going through a challenging time for the Muslim Ummah. I'm not going to take too much of the time because I've got some key speakers to speak. And then, inshallah, me and Brother Umar will give you some feedback from our cemeteries, from Eternal Gardens and Garden of Peace, what things have been put in place. The whole purpose of this meeting was to actually unite everybody, get everyone together, especially in London, where there's a lot of conflicting messages going out there at the moment, and we need to work as one ummah, one team, and inshallah show our local councils and all the people in government that we can and will, inshallah, are prepared for this challenge. Jazakallah khair. I'm looking forward to this. Sheikh Yunus, over to you. Jazakallah khair.
Rahman Rahim. So I think the purpose of this meeting is to try and ensure that all of us in London have one stand about how we're going to deal with the funerals that are COVID-19. One of the issues that we've had is, especially across the country, lots of conflicting messages coming out, whether we can do ghusl, whether we can't do ghusl, whether it's infectious body, it's not infectious. All this wording and all this terminology and everything, we really need to think about what the guidance is from the government. Okay, so we've been waiting for the government to give guidance. We already have guidance from the World Health Organization. We already have guidance from European Infection Control. We already have guidance from the Royal College of Pathologists. We already have guidance from America, their infection control. We have guidance from Australia, infection control. All that has been looked at. And from all that we've read, we can do ghusl of every single person who dies from COVID-19. That's the conclusion. However, there is precautions that we need to take when we do the ghusl. And I'm going to ask Muhammad Umar to mention how they've been doing ghusls already, and Asif Bhai as well, because if we can do ghusl, this is a right of the deceased. This is a right of the deceased. Mufti Abdul Rahman can mention further in terms of the religious duty that we have towards the deceased. But if we can take precaution and we can do the ghusl of that individual, then there should be no messages going around. Some bodies have already made the decision that we're going to do tayammum, we can't touch the body, we can't do this, we can't do that. I mean, if we have the ability to do it by taking precautions, and we have to take precautions, okay? I'm not saying don't take precautions, but if we take the right precaution, then we can do the ghusl and fulfill the right of the individual who has died and who is a Muslim, and the right of ghusl can be done. So the main thing that I wanted to get across, now I'm at the last 2 days I've been at Excel. At Excel, they are preparing a 4,000 bed hospital. 2,000 beds will be intensive care unit. Okay, there will be a massive mortuary there which will hold approximately over 600 bodies. 600 bodies. And they are also looking at external storage as well, right? And they expect that if this goes to the worst case scenario, 66 people will die every single day in that hospital alone. That's the massive, and people will not only be from East London in that hospital, people will come from all over London and even further afield to that hospital. So we as London zimmedar, responsible people, need to think how we will work together to ensure that we can do the ghusl quickly and we can do the janazah quickly. And that's why one of the things that I've told Muhammad Umar, that I don't want his and Asif Bhai, your Eternal Gardens to be the only place where we can do COVID-19, because we cannot burden only one place or two places. Yes, we can use their cemetery, but if we have to do ghusl, we need to do it everywhere, and we need to learn how to get those precautions. So one of the things that we're going to do is to make sure that a video goes out in the next 1 or 2 days that shows what precautions need to be taken. And then you will be able to do ghusl in your own places. Muhammad Umar, I'm going to pass on to you to just give us some of the experience. If you can speak for about 5 minutes in terms of the precautions, how you're getting the bodies, how you're collecting the bodies, the precautions that need to be taken, etc., etc. And then we'll move on to someone else, most probably Mufti Abdul Rahman, in terms of just emphasizing the importance of the ghusl within Islam and the duty that we have towards every single Muslim who dies.
Bismillah ar-Rahman ar-Rahim. Very simply, we have done so far today. With today, we have done 19 ghusls, of which I have done personally. I have done 13 ghusls I've done personally. This is very simple. Body comes in a body bag. All you need to do is you need to ensure that you wear a protective fluid protection gown. You wear a mask. You wear, if you have goggles for splashing, you wear that, and you wear double pairs of gloves. That's all. You take off you club, as soon as you open the body bag, you make sure that the mouth is closed. Either we can use cotton wool and tape it, or you can use a mask there of the deceased. You then take away the normal way, however you take the body, that's what you do. One thing you don't do is that, you know, on sometimes when you have a hospital patient, you have either some cannulas or you might have some plasters. Don't touch that at all. And then you proceed with a normal ghusl in the normal way. Do the farais rather than doing the sunnah. So that in the istinja bit, just try and place water rather than trying to do it in that normal way. So that's how we've been doing. So we do the ghusl in the normal way, including putting kafur, everything. And then we make sure that the body is wrapped once again in a proper 3 pieces of cloth. We are at the moment putting in a body bag and then wrapping in a sheet. But that will have to change very soon, because when Public Health England comes in to say no body bags required at all, then we will do. But please make sure that's a different body bag, not the body bag they came in. So it's not that same one. We have done it, but it has to be done with precautions. That is the most important thing. And after you have finished the ghusl, you have to make sure that every area is disinfected so that you don't have any chance of infection, including the door handles and all that. This is the main task of it, really. So and we also recommend that none of the family members are participating in the ghusl. This is because to try and save yourselves, and also if they have been in touch with the deceased, you don't know whether they've contracted COVID-19 or not. Every one of us are potential carriers of COVID-19. So we have done it. We then take it for normal burial. My staff normally do the burial itself, and that is no problem, the normal way. We don't have to wear the hazmat suit and all this when we're doing the burial. It's sufficient to wear a mask, and it's sufficient to wear a pair of gloves for the people who are handling the body which is going to the grave. That's it. So this is how we've been doing it, and that is what I'm trying to tell you at the moment. I don't want to go into detail because I don't think it's really necessary at this stage, and I just want to stick to what I've been briefed to do so.
I'm just going to come back on what Muhammad Umar said. Now, at Excel, we have had about three infection control leads who I've been speaking to try and ascertain the risk that we have in terms of when we're washing the body. Now, one of the leads has been someone who has written the Royal College of Pathologists guidance, number one. So he's very, very high up. Another one is in the defense industry, and he's in the army, and he's the lead for infection control there. And the third one is the infection control lead at the moment at Excel, who's been brought in as well. I've got her name, but I don't know where she comes from. All three of them said the body is washable. The body is washable. But all three of them said you still have to take precautions. Now, what precautions we need to take is something that we will clarify in video. You don't have to have the FFP3 mask, the very tight mask that doctors are being asked to wear. You can have the normal mask, just cover your nose, cover your mouth, cover your eyes with goggles. And even if you wear an apron, even if you wear the full, or even if you wear an apron, that is enough. But the gloves is very important. You've got to make sure that no skin is exposed. No skin is exposed, because that's where the corona. And then after you've done the washing, make sure you wash your hands properly. Okay. And then again, as Muhammad Umar mentioned, now another thing I remember, that Leeds Teaching Hospital 3 days ago, they said that the body is not infectious, so much so that after the person has died, they say we're not going to bag anymore. Today at Barts Health NHS Trust, they sent a circular that we don't need to bag a body because it's not that infectious. So this is where we are at, and we've got other people who are saying that we're not going to do ghusl. Yeah, so this is the reality. The reason why we haven't, the NBC, the National Burial Council, have not issued guidance because we were waiting on the government document to come out. And then we were going to issue guidance as per the government document. We don't want to give, we've got the Royal College of Pathologists document, we've got the WHO document, we've got the European document, we've got the American document, but we just wanted to wait on the new guidance that's going to come out. Mohammed Umar, any news on when it's going to come out?
Yeah, I've phoned up Cabinet Office today, and they are saying that imminently tonight. I have also just expressed what you're telling Maulana Yunus. If you are wearing sleeveless aprons, please do not roll up your sleeves, because
Yes.
that is very important for you to bear in mind. Okay. Secondly, just to make sure that I have spoken to them, and I have told them categorically that if you do not issue the guidance, there's going to be a riot. I've just really played it up because I'm not lying to you. I had a call today from a popular GP where someone died at home. They called so many people, nobody was willing to go and pick up that body. They called me up, I can't pick up because I had 5 bodies to pick up, right? And they were saying this GP and a CCG was saying, I don't understand, there is no risk at all for you to go and come and collect the body. Right. And so this is why he said that. I said, well, don't come to me, go to other funeral directors and ask them to up the game. If they don't do so, what am I going to do? So I just wanted to just add on that aspect of it.
Jazakallah.
But just to let you know, Maulana, if I just add, what I've just been told as well, that the new guidance will be very simple, no body bag required, minimum amount of PPE required, and absolutely safe to wash the body. That's what we'll be saying. And that guidance will be in conjunction with NHS, in conjunction with all of the delivery periods at all the delivery end as well.
Okay, just on the point of, so the important point, don't leave any skin exposed. Okay, don't roll your sleeves up. I'm going to do a ghusl, so I'm going to roll my sleeves up. Okay, this is not about becoming bahadur or anything like that. This is about being cautious. Secondly, a very good question by Maulana Zakaria Sayyed, is there a particular way the PPE items should be taken off and disposed of? One of the infection control people today told me that is one of the most important parts. 2 things. One, yesterday, the infection control person who I spoke to yesterday, he said that there is more hazard in the number of people attending and mixing in the funeral than there is from catching coronavirus from the body. And that's why I think we should be very careful in the numbers that attend, because we can't control a bigger crowd. So I think we need to agree that either, I mean, I know Muhammad Umar has set 10 as their numbers. I think we also need to agree across the board that we will tell families, because of the risk that so many people will come, we have to limit the numbers to 10 or 15, and that's it. Okay. Asif, just unmute yourself 1 second. Asif, unmute yourself. Yes, go on.
Can you hear me? Yeah. Yeah.
Yes.
On that point, I mean, just to give clarification, I mean, we're following the same rule as Garden of Peace, so we're limiting it to maximum of 2 cars, and 10 people, and that's one of our biggest problems at the moment. I'm sure Brother Umar can agree, is that when we even state that to the FDs and the families, we're still getting crowds on the park, and we've got to stop that. And from next week, my company, Eternal Gardens, will actually be closing the park. And like Brother Umar, we'll be closing the gate, and we'll be only letting in the 2 cars with the families. Yeah.
Okay, so that's number 1. Number 2, about the PPE, taking off the PPE. There is a video which has been produced by PHE, Public Health England, or it was on the BBC as well. You have a look at that, watch that, how to take off the PPE safely so that you're not infecting yourself whilst you're taking off the PPE. Okay, so that's very important. Just one more question before I move on to Mufti Abdul Rahman Sahab. How can we trust the government when they were going to go for immunity, herd immunity, and therefore they might be saying no bags, etc., etc. We will go with the government guidance, and I will try and get these infection control people that I have access to at Excel to give me a document, write an SOP for the Muslim community. And it's coming from not the government, it's coming from professionals who work in the field who want to keep our Muslim community safe. So I tried to get a hold of them yesterday and today, but it's been a bit difficult for me because of they're regularly in meetings. Muhammad Umar, quickly.
Yeah, I just wanted to respond to Mufti Mangyara Sam. The reason why the government can be trusted now is because the first stage was containment. They were saying COVID-19 people who are in association with it. Now the entire COVID virus is in the entire community. So the virus is already there. We have gone from containment, now we've gone into delay stage. That's the more reason why that's the guidance have come out. And just one point, please, Maulana, you didn't mention. Yes. We are taking advice from Professor Alimuddin Zumla. He's the leader in infectious disease, right? I would say internationally. He's advising the government as well. He's also advising all the Arab countries. He's advising WHO. He advised China. He advised a number of other countries. So we are not just taking these decisions on our own. We are consulting with him as well. And Alhamdulillah, there is another brother, Usman Dar, who is part of Public Health England. We have taken his advice as well. And both of them are unanimous that it is absolutely safe to do ghusl.
Yeah. There's a question out there that some of the bodies will be sealed in bags. Okay. So if it's not infectious, why are they sealing in the bags? Now, this is a very good question because in Excel, that's what they're thinking of doing. So I asked a question to the infection control guy that Barts is saying you don't need a body bag. Leeds Teaching Hospital is saying you don't need a body bag. But you yourself are saying it's, and yourself, you're telling me whilst we're walking to the planned space for mortuary that it's safe to do ghusl and washing. And now you're saying that you're going to have a double body bag, or you're going to have a body bag which is sealed. So he said to me that this is what they've decided because there is some risk, not very, very minimal risk. And the risk is when the mouth, if you move the body, then something might come out of the mouth of the deceased. And that's why they want to be safe. So that's why they put it in a body bag. But when we are doing ghusl, before we do ghusl, as Muhammad Umar mentioned, the first thing we do when we open the bag, close the mouth, put something on the mouth, close the nose as well. And then from then on, you're safe. Okay, so that's very, very important.
Assalamu alaikum. Can you hear me?
Salam.
Just following on from my Yunus Sab's answer, so for example, Guy's St. Thomas Hospital Trust, they've had a policy for many years now that any bodies that are deceased from infection, they will be double sealed, and that makes it very difficult to do ghusl. So in the short amount of time that we have, you know, are we going to be able to sort of convince them otherwise to change the trust-wide policy? What do you advise on this?
So even though the bag is sealed, we can, when we get the body, we can go and do ghusl. There's nothing stopping us from breaking the seal and opening the bag and doing the ghusl. Muhammad Umar, unmute yourself.
Yeah. Sorry, just to tell you, all the deceased I've received, right, is only one where there was with a double bag. And the reason why it was with a double bag, because there was a lot of liquid coming out, blood leakage and all that. Yeah, so leakage. So we didn't touch that, right? But all of the other ones were very simple. And when now, nobody have I received which is sealed. It is zipped. It's not sealed. None of the bodies I've received is been sealed. So if it is sealed, then they would put a seal on it that you are not able to open it. This is just a zipped body bag. That's all I've received. All the deceased I've received it only on that one. And even the double bag was not sealed. It was just zipped. So there is a difference between sealed and the difference between zipped. Please.
But as I said, I think in Excel they are thinking of sealing the bags. But again, that is just for safety reasons. It does not stop anyone from, after the funeral director has picked up the bag, you carry on as normal as we have been doing everywhere else. So there's no issue in us unsealing the bag or breaking the seal and washing as per our duty towards the deceased.
Okay.
Maulana, they're trying to keep, the reason why they're also sealing it, because they are not knowing how long the body will be remaining in storage. That's the issue they also have.
Yes.
Because that's the problem. They said if it's going to remain there for 1 month, it's going to be, that might be a more risk of that aspect of it. And that was the main reason also, not main reason, that's one of the reasons why they wanted to also put it in a seal bag.
Assalamu alaikum wa rahmatullahi wa barakatuh. I guess you can hear me, right?
Yes.
Yep. I don't think I need to add too much. I'm sure everybody understands this, because I mean, we can understand this from the fact that when the cremation idea was just floated, there was mass hysteria. So alhamdulillah, that's been put down. And that just shows that people are very, very concerned about how they die and what's going to happen to them, regardless of how they live their life. That's a very important, and it's a fardul kifaya on us to do that properly. What we don't want to do, because the calls that we're getting from different cities, they want to play it overly safe, but it almost looks like, because certain medical doctors who are at the forefront of this and they're seeing the horror in the hospital itself, in a very kind of, they're trying to push for the highest level of precaution. And in that, they're basically just saying, let the body bag, just do tayammum, whatever the case is. So I think, mashallah, from what I'm hearing today, this is really good, because for the last 3-4 days, it's just been inundated with calls for guidance. And I've been trying to contact Omar Bai and Mufti Zubair and others. So this is really good that we'll be able to actually uniformly provide that guidance, because as I said, ghusl is extremely important, that they be bathed properly. It's the last rite that needs to happen to them. So inshallah, this is really good news coming out. I'm also willing to basically volunteer to do a ghusl once the guidance is out, and let that be seen by others. I'm sure Mawlana Yunus Sahib can do that as well, just to give people some kind of satisfaction that we're at the forefront trying to do this, to show them that it's not as hazardous as people have made it out to be. So Jazakallah khair for this. Yeah, mashallah, there's a lot of people here, and basically I think one of the roles we're supposed to be playing here is to, inshallah, provide any kind of religious jurisprudence guidance. So I'd just like to, before I leave, just like to let everybody know that if they have any questions related to any specific issues related to funerals, etc., during this time, then please feel free to contact us through Zamzam Academy. You can actually, there's a questions page on there. Maybe Maulana Hilal can put a link up, inshallah. And basically, if you, we've got a team working on responding to the fiqh inquiries. Any fiqh through White Thread Institute, inshallah. So Maulana Hilal will put up the link. So if anybody needs any help, inshallah, we'll try to get back to them.
Jazakallah khair.
Jazakallah khair.